Hello everyone, my name is Amanda Anderson and today I will be talking to you about aneurysms. So you might be asking yourself, what is an aneurysm? Well, the definition of an aneurysm is the ballooning of an artery due to a weakened vessel wall. It is susceptible to rupture, leading to severe bleeding and could lead to death. This definition is also available in our A&P book on page 783. It is the Clinical View 20.2. So aneurysms most commonly occur in the arteries at the base of the brain or in the aorta. They are also known to happen in other areas of the body. So the picture I have shown here is also from our textbook. The picture on the bottom, towards the left there, is a normal aorta, and the one right next to it is a large abdominal aortic aneurysm. And on the right side, the picture of the brain, there is an aneurysm in the brain. So how does an aneurysm occur? Well, as we age, elastic and muscular arteries are generally less able to withstand the forces from pulsating blood. The systolic blood pressure, which is the pressure in your heart when it contracts and pumps blood, may increase with age, causing this problem. Aneurysms are more common in the elderly, individuals who smoke or use drugs, people with high blood pressure, and those with a family history of aneurysms. And an aneurysm is actually diagnosed with a CAT or CT scan or MRI. There are a couple different types of aneurysms that I would like to discuss today. The first one is going to be an abdominal aortic aneurysm, and that occurs where the aorta carries the blood into the abdomen. A cerebral aneurysm, which is a sac of blood attached to an artery in the brain. A thoracic aortic aneurysm is when the aneurysm forms in the upper part of the aorta in the chest. Carotid aneurysm is when an aneurysm occurs in the blood vessels that return blood to your neck, brain, and face. The popliteal aneurysm would occur in the artery behind your knee. The mesenteric artery aneurysm would occur in the artery that brings blood to the intestine. And we have the splenic artery aneurysm, which would occur in the artery in the spleen. Some signs and symptoms of aneurysms are confusion or dizziness, difficulty swallowing, fatigue, headache, nausea and or vomiting, intense pain in the abdomen, chest, or back, a rapid heart rate, and even vision changes. There are a couple treatments I would like to talk about today that I found with my research. The first one is going to be an endovascular aneurysm repair, also known as an EVAR. These are used to mainly treat aortic aneurysms. It's a minimally invasive procedure used to treat an aneurysm. There is also a thoracic endovascular aneurysm repair, also known as a TEVAR. And this procedure is used for thoracic aneurysms, and the procedure is similar to the EVAR. There's the fenestrated endovascular aneurysm repair, also known as FEVAR, and this would be used if your surgeon needed to construct a special graft with custom openings for the aneurysm repair. There is also open surgery. Just to continue on the treatments a little bit, I have a couple others that I found interesting. There is the microvascular clipping. So this is actually an open brain surgery that treats cerebral aneurysm specifically. The surgeon places a metal clip at the base of the aneurysm to cut off the blood supply. There is also a catheter embolization. This procedure completely cuts off the blood supply to the aneurysm. In this procedure, the surgeon inserts a catheter into the affected artery using a tube to place medication or embolic agents that prevent bleeding. And lastly, there's the endovascular coiling procedure that treats cerebral aneurysms. And with this procedure, the surgeon inserts multiple coils through a catheter to pack the aneurysm. And they pack the aneurysm to reduce blood flow and eliminate the risk of rupture. Um, while I was doing my research, I found some interesting facts about aneurysms that I would like to share with you guys today. So the first one I found was the evolution of the treatment of abdominal aortic aneurysms occurred back in 1817. And this is when the first aortic ligation was performed for the treatment of a ruptured external iliac artery aneurysm. Unfortunately, the patient died 4 hours after the procedure. And we jump up to 1923, and that was when the first surgical treatment for the treatment of arterial aneurysms occurred. And the most interesting fact that I found, and I was not aware of this, maybe a few of you were, but Albert Einstein, at the age of 69, required surgery for an abdominal aortic aneurysm. So what they did was they wrapped the aneurysm in cellophane to hopefully stop its growth. And this actually allowed him to live for 7 additional years before the aneurysm ruptured, which unfortunately caused his death. And the last interesting fact I have for you guys today is in 1990, Haradi performed the first successful endovascular surgery in humans. And this last page I have here is my references. I just wanted to thank you all for joining me today and listening to my little tidbit on aneurysms, and I hope you all have a great rest of the semester. Have a good one, guys. Bye.